We interrupt this program for breaking news from the Global National Newsroom.
Good morning and thanks for joining us on TV or online. I'm Colleen Christie and we are waiting for the latest update from Prime Minister Justin Trudeau. He is set to speak in about 15 minutes outside his home at Rideau Cottage in Ottawa, where he has been in self-isolation now for more than 2 weeks. His wife Sophie has recovered from COVID-19, but the Prime Minister says he will continue to work from home, as many Canadians now are. For the Prime Minister, let's go to our Abigail Beeman in Ottawa. Abigail, what are we expecting to hear from the Prime Minister today?
Good morning, Colleen. Well, we're not expecting a new or major announcement this morning. We are expecting the Prime Minister to speak more about the support that his government is promising Canadians. In terms of yesterday's announcement, the biggest highlight there was the wage subsidy. So Trudeau had previously promised a 10% wage subsidy for small and medium-sized businesses in an effort to keep people on the payroll. Yesterday, that was bumped up to 75%, but there are still a number of questions there about just who is eligible, what size of business, is there a cap on the business size, is there a cap on the amount, and the Prime Minister had previously promised those details by Monday, so we'll see if we get any more today. Also, other supports promised for businesses. One example is the government-backed loans that were promised yesterday. That's tens of billions more dollars, but still waiting for some more details on those. So we will find out in just a few minutes. And also the Prime Minister will be taking questions once again.
Abigail, just remind us about some of the things that the Prime Minister has said about what help will be available to Canadians.
Well, what I was speaking about a moment ago was just in terms of help for employers to keep employees on the payroll. And that was something that the Prime Minister stressed was very important, that he didn't want to see employers laying people off if possible. We know that lots of Canadians have already faced layoffs. That's help via the employer. But of course, the bigger program that was announced previously is the Canadian Emergency Response Benefit. That was part of the $107 billion aid package that was approved by Parliament. That's help directly for Canadians. So anybody who has been affected by COVID-19, whether you are a parent who has to stay home because you have children at home, if you are sick, if you are in quarantine, the government is aiming to make this fairly simple for Canadians to access, up to $2,000 a month for 4 months. But the portal in which Canadians can access it is not yet up and running. So the target date there is April 6th, and the government has been promising 10 days between when you apply and when those funds will start flowing, ideally in their goal via direct deposit into your account. So that is the biggest help in terms of direct funds to Canadians. It had previously been two separate programs. That was rolled into one when that legislation was passed.
And it's going to be doubly difficult for a lot of folks, given that the Service Canada offices have been closed. So people are relying on online primarily to get any kind of information or help.
That's a really important point, and we know that the website has been crashing. We know that the phone lines are difficult to get through. This is causing a lot of anxiety for people who just want answers and information and to be able to get that financial help. One thing that should help through that process, if you are already in the EI system, if you're already getting EI, you don't need to apply again. This should work out through what you're already signed up for. It's really more of a question for the Canadians who will be accessing this system as a new applicant. And with those Service Canada offices closing, important to note that it's the in-person locations that are closing. The government is promising that, of course, online and telephone Service Canada options will remain open. But, you know, we saw the pictures yesterday of Canadians showing up at Service Canada offices with those doors closed. There are lots of people who still rely on the in-person services. We did hear the Prime Minister address that yesterday. We saw it in the press release. There was some vague information information that, if you are very vulnerable, there will be some exceptions made, but not a lot of details there as to those Canadians who don't have access to the internet, who are having trouble perhaps getting through online or for whatever reason need to see somebody in person. Not a lot of details yet about how that will roll out with the Service Canada offices shuttered. So a lot yet to see as to how this will all roll out. Again, that target is April 6th in terms of the online portal being open, but whether Canadians will be able to get this much needed money within 10 days remains to be seen, along with a lot of questions about the wage subsidy and employers helping employees as well.
And let's talk briefly about the help for small and medium-sized businesses. Still a lot of questions and details there that haven't been answered. $40,000 interest-free loan is available, but the other question is when and what constitutes a small or medium-sized business?
Absolutely. And after the Prime Minister spoke yesterday, the Finance Minister also held a news conference in the afternoon, and he was also open that, not all the details here have been worked out. They're going to try and get the information to people as fast as possible. But that has been an issue in, the response to coronavirus in general, in that we've had a lot of information put out, not always clear, not always accurate. We've seen, a few cases of an official or a minister misspeaking. It had to be corrected. It's a lot that's being pushed at people in an effort to help, but obviously some confusion there as well. So I suppose in this case, the government wants to get it right and are withholding some details until everything can be firmed up. But again, one of the biggest questions in terms of the help for small and medium-sized businesses, how big or how small do you have to be to qualify for that help, for that wage subsidy, and up to 75%. But is there a cap on that? Is there a cap on how much money will be provided? So those are some of the things that we are still watching for.
And the clock is ticking for a lot of those businesses right now. Thank you, Abigail. We'll check in with you in a moment. Let's take a moment to check in on the situation across the country and around the globe. The number of Canadians who have now tested positive for COVID-19 is nearing 5,000. Quebec has more than 2,000 cases. There are nearly 1,000 cases in Ontario. In total, in Canada, 55 people have died. That's now more than the number of deaths that occurred during the SARS outbreak in 2003. Now, the hope is that the number of cases worldwide will soon begin to level off, but that isn't happening yet, and it may not happen for some time. More than 600,000 people around the world have been infected. But it's the United States that has seen the biggest surge in cases. More than 104,000 people have COVID-19 there. That is significantly more than in China and Italy, the previous epicenters of this outbreak. Although so far those countries have recorded far more deaths. And of course, those numbers are fluid because we know that in the U.S. they haven't been doing as much testing as in other countries. So the numbers may be actually a lot higher than what that indicates. We're watching developments in the U.S. With Washington Bureau Chief Jackson Proskow. Jackson, if America is the world epicenter, New York is definitely the epicenter of America right now.
Yeah, good morning to you, Colleen. 46,000 of those 104,000 cases are in New York State alone. New York City has been particularly hard hit. And to give you a sense of that, we saw one hospital that had more than a dozen patients die in a single day. In New York City, there are more than 450 uniformed police officers who have been diagnosed with COVID-19, more than 200 firefighters, and really it is a dire situation there. They are working to convert a convention center in New York City to a 1,000-bed field hospital with the capacity to add another 1,000 beds there. They're looking at 8 additional sites of similar size right across the state. And hospitals now have had to activate their emergency plans here, which includes building temporary morgues outside in tents, bringing in refrigerated trucks to hold the bodies, and of course doing what they can to keep people safe at home as best as possible. The city in recent days has recorded more calls to 911 than they did on September 11th, 2001, to give you a sense of the strain that's being put on the system there. Doctors describe war zone-like conditions in the hospitals, and really it's an apocalyptic scene there with lineups snaking around the block at hospitals as people wait for coronavirus tests.
Now, what about supplies like ventilators? What's the situation there?
Well, this has become sort of a political hot potato. New York State has said, based on the predictions of the apex, they feel that the maximum number of cases will peak in about 21 days. And they say at that time they're going to need 140,000 hospital beds and 30 to 40,000 ventilators. But those are numbers they just don't have right now. They've been pleading with the federal government to step up and provide them with more ventilators, release more from the national strategic stockpile. There's been a trickle, and New York is starting to get closer to the number it needs, but they're nowhere close to what they actually think they will need at the end of the day. And Colleen, this all became complicated when President Trump phoned into a cable news show on Thursday night and cast doubt on those numbers. He said he didn't think anyone would need 30 to 40,000 ventilators. He really doubted those numbers. He then turned around and signed the Federal Defense Production Act and is now compelling automakers like General Motors to make ventilators. The question, though, is whether it will be enough in time to meet the expected surge in demand. It's hard to see how they can whip up that many ventilators in just 3 weeks' time.
And Jackson, it appears politics are sadly leaking into policy as well, with the president indicating that he would give preferential treatment to states that had supported him.
Yeah, it really comes down to a feud he's been having with a number of state governors who've been critical of the federal response. And over the past few days, Trump has made it clear, and I'm paraphrasing here, but he's essentially saying, if you don't say nice things about me, if you don't treat me well, I might not take your call. Now, that may have just been an effort to fire up his base. Remember, it's an election year down here. Still not clear why politics would factor into a pandemic response. But the fact of the matter is that despite openly feuding with the governor of Michigan, for example, Trump then turned around this morning and eventually did sign a disaster declaration for Michigan to help free up some funding for that state. But certainly kind of got the impression that state governors and public health officials are sort of on tender hooks around the president. They're choosing their words carefully because at the end of the day, they can't afford any delay that could be brought about by not saying nice things or not having the president on their side. And so they're doing what they can to win over his support. So you've seen governors like New York's Andrew Cuomo sort of temper his criticism of the federal response by also offering up a dose of praise at the same time by saying that it's nice to see the federal government slowly step up to the plate here and help out.
Jackson, every prepared medical or region will have guidelines for how they will handle this emergency, but we are hearing that some hospitals are now publishing guidelines about who they will treat in a worst case scenario. What are you hearing?
That's right. A leaked memo from a hospital in Michigan actually spelled out that doctors and nurses may have to make some tough choices if they run low on ventilators and ICU beds. And essentially, it is laying out a similar scenario to what we've reportedly heard from some hospitals in Italy, where they have to make very tough choices about not treating people over a certain age or with certain pre-existing conditions. Essentially, they are talking about triaging the equipment they have for people with the best chances of long-term survival. That's really what it comes down to. Other states have issued more controversial memos as well, talking about who may and may not qualify for treatment or who may or may not be prioritized when resources become scarce. Alabama is one state that, for example, talked about people with severe dementia perhaps not being included for treatment up front if supplies run low. These are really the dire realities that some hospitals may have to face if they have to make these tough decisions.
All right. Jackson, we will check in with you a little bit later on. Thank you for that. Let's head now to London, where Redmond Shannon joins us in virtual lockdown. Redmond.
Yeah, that's right. London, like so many parts of Europe, like so many parts of the world right now, Colleen, is in lockdown. Only essential services are open, like supermarkets, places to get medicine, and you can only go outside once a day, otherwise for one allowed period of exercise. So that's what London is right now. Things have really, in the last day, ramped up, and I think people are getting the seriousness of this a lot more, particularly given that the three political leaders, or the three people who are managing this situation at the very top, all contracted COVID-19, that being Boris Johnson, the Prime Minister, his Health Secretary, Matt Hancock, and the chief medical officer, all testing positive yesterday. And now today we're learning that another member of the cabinet is in self-isolation with a possible case of COVID-19 as well. So this really ramming home to people how serious this is. And in the last hour or two, Colleen, the numbers in the UK of deaths has risen dramatically from 750 up 1/3 to over 1,000 now in the UK in 24 hours. So a real jump in numbers to hammer home just how the UK seems to be following the path of countries like Italy and Spain, where this is such a terrible, terrible disaster, particularly in Italy. More than 900 deaths reported in 24 hours and more than 800 in Spain. So many European countries going through such difficult times, and it seems like that is what is lying ahead for the UK in the coming days and weeks.
Well, and the message must be particularly being driven home with the Prime Minister now infected, given that not long ago he said he refused to stop shaking hands despite the pandemic. Yeah,
that in early March, about 3 weeks ago, Colleen. So about a week later, so that about March 10th, he did roll back from that. But in early March, he said he was going into hospitals
Redmond,
where people were
I'm
being
going
treated.
to have to interrupt you. The Prime Minister is about to speak. Let's listen in.
We're here to bring you all the day's top developments. And
Saturday's usually a time where we get to get together with friends, spend some time with the kids, with family. Obviously, this is another different Saturday as we've had over the past few weeks. We need you to continue to stay home. We need you to continue to do everything we can to flatten the curve. Obviously, there are sacrifices we're all making, but it's beginning to work. We see promising news out of BC that over the past couple of weeks, the measures taken in place by so many Canadians, the choices that Canadians have made have had an impact on the overall numbers, but we need to keep it up. We need to continue to do what is necessary to prevent the spread of COVID-19, which means continuing social distancing, continuing to not go out unless you absolutely have to, continuing to think about caring for each other, thinking about protecting each other, and thinking about protecting our healthcare workers and those essential workers who are doing such extraordinary service to keep things going, to keep us safe at the same time. C'est une responsabilité que nous partageons tous.
This is our common responsibility to stay home and do our utmost in order to prevent the spread or the lengthening of this crisis. And this is a wonderful Saturday, I know, but it is important for us to stay home. It behooves us to do so and not to do anything that might endanger the lives of our friends or health professionals. Now, as you know, we have encouraged people to stay home, in particular if they are developing or have developed symptoms of COVID-19.
Symptoms of a cold, of COVID-19, you need to stay home. You need to isolate. You need to not travel. People have been following that, but I can enhance that we have formalized some of the domestic travel rules. As of Monday at noon, people showing any signs whatsoever of COVID-19 will be denied boarding on all domestic flights and intercity passenger trains. Aujourd'hui, j'annonce que Transport Canada a amené de nouvelles règles pour les voyages.
I am announcing that Transport Canada has adopted new rules regarding traveling. Of course, if you have onset of symptoms, you should not travel. You should stay home. So, as of Monday, 12 noon, if people want to travel by air in Canada or by train, intercity train, they won't be able they won't be accepted on board if they have any kind of COVID-19 symptoms. We must continue to practice social distancing, physical distancing, and we should make responsible decisions. And I would like to thank the millions of Canadians who do exactly that. This is so important for the purpose of making sure that we continue doing what's the right thing to keep secure and continue go through the crisis and have a prosperous country, a healthy country, but each and every one of us has to do his or her part in this over the next few days. And last night I was lucky to do something which I love to do. I was able to spend some time with members of the Youth Council, Prime Minister's Youth Council, and to me, of course, that was an online meeting, but even a virtual meeting gives me so much energy. And I was in the company of Minister Boris Jagger and two more ministers, and we had a very open conversation with the young people across the country.
With the young people on the Prime Minister's Youth Council last night were extraordinary. Obviously, lots of questions and comments around COVID-19 and vulnerable populations from the north to internet access and broadband access for rural communities, questions about what young people can do, questions around what they can tell their friends who are doing well or not doing well, conversations about mental health as well, because obviously this is a moment of anxiety and stress for so many people. This was a great conversation, like so many of the great conversations being had amongst Canadians across the country. Our young people specifically, we've been counting on them over the past years to continue to step up in the fight against climate change, in the fight against poverty, in supporting a better world internationally and at home. And we continue to need young people to be that vehicle for building a better future and sharing messages. Obviously, young people, like every generation, are chafing at the bit in terms of having to be self-isolated, particularly at a time when we tell our young people at an age where we say, now is the time to go out and discover the world, whether it's with a backpack or in a laboratory. Make new discoveries, challenge yourselves, challenge the world. And they're looking at their plans for the spring and their summer jobs, and they're realizing that there is a massive anxiety and a massive uncertainty out there. But that doesn't mean we're powerless. Doesn't mean they're powerless. On the contrary, this generation of young people is so committed and engaged to creating a better world that we need you to keep leading the way you are. We need you to share your messages with friends. We need you to lead by example. We need you to be challenging and discovering the world in virtual ways. There are ways that you can continue to shape the future we all live in every single day, not just with your choices, but with your leadership. And that's what we need. We
need our youth in order for them to challenge the world, to push the envelope, to move forward. We need us for their leadership, especially during the situation of crisis. And I'm counting on you because our present situation and our future is in very good hands, thanks to our youth in the country. We also want to be here for you as young people. We want to support you, and many of you will be eligible to the emergency Canadian benefit, or others will be helped in their part-time work thanks to the assistance we give to small businesses and medium enterprises. So we will make sure that you continue to trust the future.
Yes, young people who will, many of them qualify for the CERB and be helped through the payroll subsidy that the wage subsidy we're creating for businesses and bringing up to 75%. But there's always going to be more to do, and we're going to keep listening and looking how we can make sure that Canadians get through this in the best possible way by supporting them now and ensuring that we can roar back stronger once this is all done. That's why we put forward big measures to help businesses over the past few days. Increasing the wage subsidy to 75% means businesses across the country are now realizing they're going to be able to keep people on their payroll, keep that relationship going between them and their workers. and even rehire people who they didn't think they'd be able to support over the past 2 weeks. We know that what we do now to hold things together, to give people the ability to stay home, to isolate, to hold through this difficult time is key to how we will come back stronger afterwards. But we need to stick together and we need to do it. On a besoin de regarder tout ce
We
qu'on peut
need
faire,
to look at all the things we can do, each and every one of us, for the purpose of going through this crisis. And this is why we've been helping small and medium enterprises, and we are making easier access to credit, and in order for people to have more cash, more liquidities, and then they'll be able also to borrow. We have made available $40,000 through the banks, interest-free for the first year, and $10,000 might be pardoned if conditions are met. And we'll be working together for the purpose of making sure that that the ability to go through this crisis. Our $1.07 billion plan has been adopted by Parliament, and people are impatient to see the cash arriving at their homes, and we're doing our utmost to be able to deliver to Canadians quickly this cash, because this is an unprecedented situation. And the emergency Canadian benefit will provide you $2,000 each month over the next 4 months. So do register in Mon Dossier at the relevant agencies as soon as the portal will be opened over the next few days. And also do register at direct deposit.
The Canada Emergency Response Benefit will give people $2,000 every month for the next 4 months to help get us through this time. I know an awful lot of people have showed interest in it already. My recommendation to you is to go on the Canada Revenue Agency site and sign up in advance through the My Account links. Once you do that, in the coming days when we're able to start actually opening applications, you'll have a head start. And if you can, please opt for the direct deposit option, which will let you get this money into your bank accounts sooner and is simpler for everyone as well. There are lots of things that we're doing to make sure that we get through this together. But everything we do, we need to do together. Every single individual, every single household has its role to play in making sure that Canada and Canadians do well through this. We also have a role to play in making sure that the world gets through this, both by modeling solutions and demonstrating what can be done when we all work together. This is going to be key, particularly as parts of the world that are much more vulnerable are beginning to get harder hit. We need to be able to get through this so we can help rebuild a world in which people can prosper and everyone has a real and fair chance to succeed. I know Canadians are up to this challenge. I know we're going to do this together. J'ai énormément confiance dans les Canadiens.
I'm tremendously confident that Canadians have the ability to go through this crisis. We will be here for one another. Thank you very much and have a nice Saturday. We'll move to the question period.
Modérateur, c'est à vous.
Merci, thank you. La première question est de Michel
The
Lamarche.
first question is from Michel Lamarche. You have the phone. Good morning, Mr. Trudeau. First of all, I'd like to hear you give us more details regarding the new measures that have been taken. Are you considering closing the borders in the provinces, or have we not reached this stage yet? We do take into account the fact that many Canadians have changed their behavior, self-isolate, have stopped traveling, so we have to take this into account. At the same time, we do acknowledge that some people have to travel in order to deliver food and essential goods. So we do not want to take steps which are not absolutely necessary. However, as I said, we will always take the necessary measures at the right time if it becomes necessary. So far, this is not something that we are planning to do in the short term.
People across the country have been doing an excellent job of staying home, of not traveling for anything that's not absolutely necessary, and we encourage people to continue to do that. However, there is essential transport and travel that is happening as merchandise, as food gets delivered across the country. We need to continue to ensure that that's happening. Every step of the way, we're going to look at whether we need to take further measures to keep Canadians safe and to keep our economy rolling on essential goods. We will make those decisions as they are needed to be made, but right now we're not looking at closing provincial borders.
Suivi, Michel?
There are snowbirds that are coming back. We're seeing them coming back today. The SQ is there to tell them to respect the quarantine measures. There's a great deal of confusion about whether people coming back can go out. When they come back to Canada, can they go out for a walk? Can they go cycling? Under the quarantine legislation, under the Quarantine Act. The Quarantine Act says that people have to self-isolate when they come back from abroad. That is extremely important. We need anybody who might have been exposed overseas to make sure they don't pass anything on to other people who are carefully protecting themselves. I would recommend that everybody follows the directives set out by Health Canada and our health authorities. Next question. Thank you. The next question is by Mélanie Marquis, La Presse.
Merci. Bonjour, Monsieur Trudeau.
Thank you. Why are buses, coaches that also travel across provincial lines not subject to the same measures? These Transport Canada measures apply to industries that are under federal jurisdiction. Some industries are not under federal jurisdiction, but we do recommend, and in fact we're putting rules in place to make sure that people do not take any trips anywhere if they have COVID-19 symptoms. If they have COVID-19 symptoms, we were asking them to stay home, but now they won't even be able to take a plane or a train.
People who have symptoms that they need to self-isolate, they need to stay home, they should not travel. Now there will be Transport Canada rules coming into place that will prevent anyone indicating symptoms to travel by airline or by train.
Suivi, Mélanie?
Thank you. Mr. Trudeau, regarding the Canada-US border, we are hearing that the US is sending some migrants back to their countries of origin, regardless of risk. What are you going to do to deal with that? We are really looking at a situation unprecedented in our country's history and perhaps the history of the world. Our response is designed to protect Canadians and to contain propagation of the virus. These are, by definition, exceptional measures. We will do everything we can to continue acting within our principles and values, but we'll do everything we need to protect Canadians in these difficult times.
Thank you.
Next
question is from Rod Nickel from Reuters. Your line is open. Please go ahead.
Premier Kenney said yesterday that he'd like to see a coordinated North America response to OPEC's actions to flood the world with oil. He suggested ideas like tariffs on Saudi oil and an anti-dumping case. Do you support these ideas, and do you support the more aggressive approach to OPEC's actions recently?
Obviously, we are very concerned with OPEC's decisions that are putting at risk the livelihoods of people around the world, particularly Canadians who work in the oil and gas sector. We are focused on helping those Canadians, helping people who are hardest hit by economically by COVID-19. The measures we've put in place will support Canadians right across the country, including in our oil and gas sector. But we also know it's a sector that has been particularly hard hit, and we will look for further help to be able to support people as they get through. In terms of international collaboration, coordination, we continue to be part of conversations on this issue around the world.
Would you look at a more aggressive approach to Saudi Arabia?
I think this is a moment that we need to focus on getting through COVID-19 as best we possibly can. I think there will be a lot of reflections on how various countries behaved in this particular moment. Our focus right now is on making sure we can support our citizens and stabilize the global economy the best way we can, which we are doing through our membership in the G7, in the G20, in various international fora and approaches that we have, while at the same time focusing on making sure we're supporting Canadians and keeping them safe.
Merci. Dernière question avec suivi au téléphone.
Thank you.
Thank you.
Last
next question is from Teresa Wright from the Canadian Press. Your line is now open. Please go ahead.
Good morning, Prime Minister. On the cruise ship anchored off the coast of Panama, what actions are being considered or will be taken to help the 248 Canadians aboard?
We have worked directly and contacted directly the Panamanian government to try and get an ability to bring those Canadians home. We know this is a very difficult situation for them, for their families. A lot of people around the world are worried about being able to get home. A lot of their family members here are feeling anxious and really want to see them brought home. I can tell you that the entirety of Global Affairs Canada employees are single-mindedly focused on this Herculean task of bringing Canadians home any way we can. And much of it involves negotiating with other countries to get permissions to cruise ships to dock, permissions for airplanes to lift off from their country where they've closed airspaces. We're going to continue to work diligently to do everything we can to get all Canadians home and provide significant consular support both in the meantime and to those people who are unable to get home.
Louis Blouin de Radio-Canada. Monsieur Trudeau.
Louis Blouin, Radio-Canada. Mr. Trudeau, can you be a bit more specific about the new measures regarding trains? Who is going to be applying those measures? Is it personnel? We saw that in international flights. People got on board even with COVID symptoms, or COVID-like symptoms. How do you ensure that the rules are applied? Yes, the rules must be applied. Companies will be required to ensure that people with COVID-19 or COVID-19-like symptoms do not go on board. People have to avoid unnecessary travel, and anyone who has COVID-19 symptoms must stay home.
That people be following the rules. It will be important for operators of airlines and trains to ensure that people who are exhibiting symptoms do not board those trains. It'll be a Transport Canada rule that will be enforced. But at the same time, we're telling people, stay home if it's not absolutely essential for you to travel. Stay home. Absolutely, if you're exhibiting any symptoms of COVID-19, of a flu-like virus. We need you to keep yourselves safe. We need you to keep your loved ones and your neighbors safe. And we need you to keep from overburdening and endangering the safety of our healthcare workers and others who are doing so much to keep us safe as a country.
Sur l'aide aux provinces, Monsieur Trudeau, vous avez déjà fait une première phase, 500 millions pour les besoins.
Mr. Trudeau, you've already allowed $500 million to flow. Alberta and some other provinces are having difficulty. Will there be a second phase of assistance for those provinces? They're in a very difficult situation. This is an unprecedented situation for everyone. We need to be there for one another, and we will try to help all provinces, all the people, and all the companies who are facing problems because of COVID-19. We are continuing to monitor the situation day to day to see what more we can do and what more we should be doing to work hand in hand with the provinces and leaders across Canada.
We recognize this is a situation without precedent, a situation that is beyond our collective and individual experience, and that's why we've made the commitment to help people who need help getting through this time, whether it's an individual, a family, a business, or indeed a province. And we continue to work every day to look at ways that we can help, look at how we can help, look at what we can do to help. Those conversations will continue to be ongoing for individuals, sectors, or indeed provinces that are facing particular difficulties.
Marika Walsh with the Globe and Mail. I want to revisit the energy sector question. Earlier this week, Finance Minister Bill Morneau said it was hours or days until the energy sector would find out what specifically the government would do. So when are they going to get the answers that they need?
We're continuing to work to try and provide workers in the energy sectors with the support that they need. We recognize that the collapse of oil prices around the world is hitting hard. People who've been extremely hard hit over the past years already. That is why we need to get this right. And we're working with provinces, we're working with industry, we're working with various sectors, including unions and others, to try and make sure that on top of the help we're already giving of $2,000 a month to people who are laid off, 75% wage subsidy so companies can keep people on the payroll. We're going to continue to make sure that once we are through this difficult time, people in industries and places right across the country are going to be able to pick themselves up and get back to work and have our economy continue to work strongly like it was before. It's going to take a lot of effort in the meantime, and it's going to take us doing different things and trying different things. But we are going to keep working until we manage to help everyone.
Hi, Ashley Burke, CBC News. As you mentioned at the top of your speech, you said that there have been encouraging signs out of British Columbia. Are you worried at all that Canadians will hear about those encouraging signs and become complacent?
I think encouraging signs is absolutely something we want to see. We want to see a decline in the rate of transmission, but people need to know that the decline in the rate of transmission happened because 2 weeks ago, people started heeding these instructions and started self-isolating and started engaging in social distancing. And over the intervening weeks, people have increased their following of advice, and that is an excellent sign. But if we're seeing a reduction in the spikes, that means what we are doing is working, and we therefore need to continue doing what we are doing. We are not out of the woods yet. Obviously, if the measures we're doing are working, we need to continue doing them, and that's why as a government we're making sure that people are able to continue doing what they're doing by flowing money to households, by supporting businesses with a 75% wage subsidy, by making access to credit that much easier. We're going to continue to do more things as we look at ways to help Canadians get through this so we can come out of this strong without a reappearance or resurgence of the virus afterwards. Si on commence à voir des résultats positifs en quelques endroits, c'est parce que
the fact that there are positive results in some places shows that the measures that they have been taking, like self-isolation, are in fact working. They are preventing the virus from propagating. So since these measures are working, they have to be maintained. People have to continue self-isolating. They have to continue staying away from one another so that we can really contain the transmission. We will have to continue these measures for quite a while, and that is what will keep us safe, and that is what is going to flatten the curve and bring down the rate of transmission. This is why we're providing so much help for families, businesses, and communities. This is why we're offering better access to credit for those who need it, so that in spite of the difficulties, they can continue following the advice that will bring us out of the crisis more quickly and in better shape.
Travelers getting on planes and getting on trains, and is it going to be based on the honor system? And if so, there have been cases of Canadians lying so they can continue to travel. How do you prevent that?
We are asking Canadians and telling Canadians that they need to remain home. They must, as much as possible, avoid non-essential travel. This is something that is essential if we are going to get through this together. Obviously, if anyone is exhibiting symptoms of COVID-19, they should not go out. They should stay home. They should not travel. And we are giving further tools to airlines and rail companies to ensure that anyone exhibiting COVID-19 symptoms does not travel. Okay. On l'a dit très, très clairement, les gens doivent rester chez eux, doivent...
We've said very clearly that people have to stay home and avoid non-essential travel. Clearly, that's all the more important when they have COVID-19 symptoms. They have to stay home and self-isolate, and they must not travel for any reason whatsoever, except to go to the hospital. But there are ways of doing that safely. People must not be taking planes or trains if they have COVID-19 symptoms or COVID-19-like symptoms. So we are providing new tools for airlines and railway companies to make sure that people who are showing symptoms don't travel.
The government has shut its Service Canada offices because it deemed frontline workers there doing face-to-face work with the public was too risky. But we're still asking many Canadians, grocery store workers, bus drivers, nurses, to do this very same risky work. Are we going to do anything more to mitigate the risk these frontline workers face and anything to personally assist them further?
We recognize that as much as possible, services need to be shifted online or onto the telephone. That is why we've moved to close Service Canada offices so that people can access these greater resources online because people will be there to work and respond to them virtually and online, while at the same time creating opportunities to actually support people who do need that extra help. But of course, there are people who have to continue to go out and work. We think of grocery store workers, we think of emergency responders. There are people who are putting themselves at greater risk every day to provide essential services to Canadians. And yes, we need to do everything we can to protect them, but each and every one of us can do things that will protect them as well. Ensuring that we're only going out for groceries maybe once a week, ensuring that we're cutting down on our movements, that we're not in situations where we're going to have to call on emergency services or essential personnel for any reasons other than absolutely essential reasons. And that means staying safe and staying at home. Yes, there's things that businesses and governments are doing in order to keep frontline workers as safe as possible. But every single Canadian has things that we can do that will reduce the risk for grocery store cashiers or delivery people who are continuing to get food to our doors. These are the things that we all need to be responsible for because people out there doing essential services for us need to be protected. Nous reconnaissons que de pas mettre les gens à risque.
We recognize that not putting people at risk and by obliging them to provide frontline services face-to-face is a good thing when they can provide services from home. But there are workers who will have to continue going out to work in our grocery stores, in other places to respond to emergencies. The government and their employers are doing everything they can to make them as safe as possible, but as consumers we can also do things to reduce the risk for them. We can go food shopping only once a week. We can avoid calling on emergency services when it's absolutely only when it's absolutely necessary by avoiding any high-risk behavior. We can do a great deal to protect the people who are crucial to us in these difficult times. And I would urge everyone to think about what they can do to help emergency workers stay healthy.
Canadians are going to have to pay their rent, and while the $2,000 a month is a good start, it doesn't roll out until after that. And then thereafter, it might not be enough to cover the rent of many people across this country. So what are you hoping will happen, or what are you hoping can happen for those who can't make rent, considering that you have worked with the banks to help people defer mortgages? What about renters?
We're very much looking at different things we can do. At the federal level, we are limited in our tools. Much of protections for renters and relationship between renters and landlords are provincial areas of jurisdiction, but we are, of course, continuing to work with the provinces on ways we can do that. Access to credit through banks will be helpful as well, as we recognize people are using their credit cards for more and more things, and those balances are piling up, and they are really concerned about things. At the same time, we can point not just to the Canada Emergency Response Benefit, but things like the Canada Housing Benefit, which will be coming out in Ontario in the month of April, will help vulnerable people be able to pay their rents. There are many different methods that we're trying and looking at in order to support Canadians through this difficult time. I recognize the anxiety with the beginning of the month coming, and we're looking at ways we can help people get through that.
Brian Mullen at Global News. Prime Minister, wanted to ask you for an update on your wife, Sophie. Has she been cleared by doctors, and how is she doing?
Monsieur Trudeau,
feeling great. My family is doing well. My kids and myself, we're all doing well. We continue to follow the direct advice of health professionals on what next steps are. But like I said, we've asked people to stay at home and work from home as much as possible, not go out if they don't have to, and that certainly is something that we're doing and encouraging everyone to do. Sophie se sent énormément mieux.
Sophie is feeling much, much better. She is doing very well, and the children are fine. I'm fine, and we are continuing to follow the advice of health professionals, as everyone should. And as everyone should, we try to stay home and self-isolate as much as possible. We don't go out if we don't absolutely have to, and we follow all advice from public health authorities. Thank you. Thank you.
And that was Prime Minister Justin Trudeau updating Canadians on the COVID-19 crisis. Let's go to our Abigail Beeman in Ottawa with what some of the Prime Minister said. The PM saying that we are beginning to flatten the curve, but we must continue to stay home, especially if we are sick. Abigail, encouraging signs, but he is clearly concerned about complacency right now.
Well, encouraging signs, specifically mentioning BC and what's happening there. But as you say, the Prime Minister was specifically asked, are you worried about complacency? And his answer to that was, well, you know, the reason we are seeing these encouraging signs is because people started to follow the rules a couple of weeks ago. He said, we're not out of the woods yet. We need to continue to do this.
Okay, he did make one announcement about new domestic travel restrictions. Fill us in on that.
That's right. So the Prime Minister is saying that starting on Monday, anybody boarding a domestic flight or intercity rail will not be allowed to board if they show any symptoms of the coronavirus, although he then also mentioned flu symptoms in general. And of course, he says nobody should be traveling if they're sick or showing any symptoms at all. A few questions about that. He was asked, why doesn't this apply to buses that travel between provinces as well? And of course, he said that is because they're dealing with what's under federal jurisdiction under Transport Canada, but that he recommends that for anybody, again, should not be traveling while sick. He was also asked about enforcement, and he seemed to suggest that it would be up to local operators, train operators, plane operators, and companies to determine whether somebody was getting on board who is sick. And of course, there have been some examples of Canadians perhaps not being honest about their symptoms. So still some questions there. He said said, the rules that were coming from Transport Canada and would be enforced, but some questions about, are you taking everybody's temperature? Are you relying on the honor system? So still some questions there.
Well, of course, because it's fine to ask people to follow the rules, but there is a desperation aspect here. People are needing to get to work, don't want to lose their jobs. And of course, each province and the federal government has put in initiatives to help prevent that from happening. But still, there are a lot of extenuating circumstances out there. Abigail, I want you to talk about another crisis that is happening right now. Another cruise ship is infected with more than 240 Canadians on board, the Dam, with 150 people who are sick on board, and I believe 4 people have now died.
Yes, that's exactly right. A sad story unfolding off the coast of Panama with the Zandam cruise ship that is floating off the coast there. And as you mentioned, we know there are 247 Canadians as passengers on board, as well as 1 crew member. We know that 4 people have died, about 150 people who are showing flu-like symptoms. And at last check, a couple of people had tested positive for COVID-19. So the Prime Minister was asked about that today. We also saw that the Foreign Minister said that he spoke to Holland America, the operator of the cruise ship. He spoke to the CEO this morning. He says, we're listening to Canadians. We're doing what we can. He spoke with the government in Panama earlier this week. So they are aware of the situation and trying to help. The Foreign Minister also tweeting this morning that medical supplies were being delivered to the ship. In a release or a statement from Holland America, they explained that another ship had been brought over, and there was a process underway to transfer medical supplies and to transfer some healthy passengers off one ship to the other, but still a lot of details, as that is an evolving situation to watch as that situation unfolds.
Okay. I'd like to talk about something a little more positive now. The Prime Minister mentioned that he was essentially reaching out to young people to be leaders the way they have been in the climate crisis. What can you say about that?
That's right. And that's always been something, youth are close to the Prime Minister's heart. That's a file he's been interested in for a long time. So not a huge surprise to hear him speak about that. But he began in his opening comments to talk about having a virtual meeting with his youth council last night or yesterday with a number of ministers who were on this virtual conference as well. He described young people facing isolation as chafing at the bit to get out. And he said, look, this is your time to lead. You need to focus on how to move forward together virtually, how to explore the world virtually. Talked about, this is a time for young people with the summer approaching, backpackers, all those things. It may not be possible, but he said, virtually you need to come together and show yourself to be leaders. It's not the first time we've heard him address youth. He spoke directly to children about a week ago in terms of how hard this is for younger children facing this crisis and stuck at home. Now his message seemed to be targeted to youth who are a little older, but that is obviously young people is something very close to the Prime Minister's heart.
Well, and also a major concern for a lot of Canadians, because if there is a demographic that has not been particularly compliant to the new self-isolation rules, it would be younger people who aren't as physically impacted by the virus, but yet as carriers, they have the potential to be the vectors to destroy our society. So they need to get that message, and it sounds like he was reaching out to them for that respect, in that respect as well. Abigail, just a reminder, he encouraged people to sign up at the My Account site at the Revenue Canada Agency site to get people on board. We are going to hopefully get more information about the financial aid package coming. Abigail, thank you so much for your time this morning. All right, let's recap on what we heard from the Prime Minister today. He praised the efforts of Canadians who are making physical distancing a habit. He says that those steps are paying off, but we need to continue to do our part to limit the spread of COVID-19. There will be new guidelines coming in regarding domestic travel. Effective noon on Monday, anyone exhibiting symptoms will be barred from boarding domestic flights and intercity trains. The Prime Minister spoke directly to young people, calling on them to lead by example in this crisis, saying they can shape the future we live in, not just with their choices, but with their leadership as well. He also reiterated the government's support for small businesses with a 75% wage subsidy to help pay workers impacted by this crisis. And he said his government is speaking with counterparts in Panama to help repatriate the more than 240 Canadians stranded on the Zaandam cruise ship. At least 4 people on board that ship have died from COVID-19 and 150 others are ill. But a government source tells Global News none of those deaths were Canadians. And a reminder once again to stay home and practice physical distancing. The Prime Minister again reminding all Canadians to do their part and that we will all get through this together. You can find full details on globalnews.ca and tonight on Global National. I'm Colleen Christie. Thanks for joining us.
This has been a special report from Global News.
55 deaths. In addition, at any point in time, there are many other people under investigation, awaiting laboratory results, or not yet tested. So even if you are not hearing of cases in your community, it doesn't mean there are no cases or that there are no exposures waiting to happen. We have now completed tests for over 184,000 people in Canada, which is more than 84,000 additional people tested since Monday. In terms of the severity of COVID-19 in Canada, the percentage of cases that require hospitalization is approximately 7%, about 3% are critically ill, and 1% of cases have been fatal. Please note that 30% of those hospitalized are under 40 years of age. We continue to keep a close eye on the severity of the disease because although there will be day-to-day fluctuations, a sustained trend of increased severity could point to a higher rate of infection in vulnerable populations or that the health system is being overwhelmed. I am reminding Canadians not to underestimate the severity of this disease. The devastating impacts of COVID-19 is evident in Europe and parts of the United States. At the same time, there are signs of hope. There is a note of cautious optimism from British Columbia, the area of Canada that first experienced community transmission. It is still too early to know for sure, but after weeks of public health interventions, the rate of growth appears to be slowing. We will be closely looking at BC over the coming week for better clarity on the effect of their public health measures. This early sign of reassurance should spur us to keep up with our new habit of physical distancing, despite the accompanying hardships. So we need to stay the course. Yesterday, we started a challenge for Canadians to build a bubble of protection and stay inside that bubble. We need to maintain this zone of protection around us to keep the virus out. Each of us should ideally have our own separate bubble that is a 2-meter circumference around us. But for couples, families, and other cohabitation situations, that bubble might mean 2 or more people, or keeping within a bubble that no one else comes into. So the important thing is to stay in your bubble and not burst someone else's. I'd also like to ask people to just check out our canada.ca website for a new interactive map on cases in Canada, as well as a more detailed epidemiologic report that's now been posted in our 2 official languages. Thank you.
Bonjour. Au Canada,
Hello.
5153 cas ont été déclarés, dont 55 décès. Par ailleurs, à tout moment, de nombreuses autres personnes font l'objet d'une enquête, attendent les résultats de laboratoire ou n'ont pas encore été contrôlés. Même si aucun cas n'est signalé dans votre collectivité, cela ne veut pas dire qu'il n'y a pas de cas ou que vous êtes à l'abri de toute exposition. On a des résultats des analyses laboratoires pour plus de 184 000 personnes au Canada, soit plus de 84 000 personnes supplémentaires depuis lundi. En termes de gravité de la COVID-19 au Canada, le pourcentage de cas devant être hospitalisés est d'environ 7%. Les personnes gravement malades représentent environ 3% des cas et 1% des cas ont été fatals. Nous continuons à surveiller de près la gravité de la maladie. Malgré les variations quotidiennes, si la gravité présente une tendance à la hausse, elle pourrait traduire un taux d'infection accru dans les populations vulnérables ou un débordement du système de santé. Je souhaite rappeler aux Canadiens de ne pas sous-estimer la gravité de cette maladie. Les effets dévastateurs de la COVID-19 sont évidents en Europe et dans certaines parties des États-Unis. Il y a aussi des signes encourageants. La Colombie-Britannique, où la transmission communautaire est apparue pour la première fois au Canada, parle d'un optimisme prudent. Il est encore trop tôt pour le savoir avec certitude, mais après des semaines d'intervention en santé publique, le taux de propagation semble ralentir. Nous surveillons attentivement les situations en Colombie-Britannique au cours de la prochaine semaine afin de mieux comprendre l'effet des mesures de santé publique qui y ont été prises. Ce premier signe encourageant devrait nous motiver à maintenir notre nouvelle habitude de pratiquer l'éloignement physique en dépit des difficultés qui en découlent. Il faut garder le cap. Hier, nous avons lancé au Canada le défi de créer leur bulle de protection et de rester dans cette bulle. Nous devons maintenir cette zone de protection pour empêcher le virus de nous atteindre. Chacun de nous devrait idéalement avoir sa propre bulle d'environ 2 mètres de son circonférence. Cependant, pour les couples, les familles, les personnes en situation de cohabitation, cette bulle peut inclure 2, 4 ou encore plus de personnes, toutes isolées dans une bulle où personne d'autre n'entre. L'important, c'est de rester dans votre bulle et de ne pas faire éclater la bulle de quelqu'un d'autre. On encourage aussi tout le monde de visiter notre site web canada.ca. Merci.
Thank you. We will now open the telephone line to questions. Vous pouvez poser vos questions dans l'une des 2 langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics to ask your questions. Operator, over to you for one question on the line.
Thank you. Merci. Please press star 1 at this time if you have a question. The first question is la première question is de Lauren Gardner de Politico. Your line is open. Votre ligne est ouverte.
Hi, thanks for taking my question. I'm wondering what kind of advice you might be providing to federal officials and maybe even officials at the local and provincial levels who may be concerned about the U.S. relaxing certain social distancing measures in the coming weeks. There have been reports of mayors in border towns who have expressed some concerns. Is there any direct advice you've been able to provide to them thus far about how to handle that possibility?
Absolutely. We are monitoring what is going on in terms of the actual outbreaks in the United States. And of course, there are many different areas of the United States that are quite heavily impacted by COVID-19. So I think, as everybody knows, that there are now border measures to reduce the impact of any illness that might come from travelers in the United States. And those are layered measures, and certainly no non-essential travel between the 2 countries is very key, while maintaining essential services and those links that are so important between the two countries. But we've also, as you know, have now a mandatory quarantine order in place, emergency order, that essentially mandate those travelers to undergo 14 days of self-isolation, so that's mandatory isolation if they've traveled anywhere, including the United States. We will be, of course, isolating anyone who is sick coming from any country, and that includes the United States as well. And the Quarantine Act, the Federal Quarantine Act, comes with it quite heavy penalties if people were not observing that order.
And one follow-up?
I'm set, thanks.
Okay, operator, next question on the line.
Thank you. Merci. The next question is from. La prochaine question est de Catherine Lévesque de la Presse canadienne. Your line is open. Votre ligne est ouverte.
Oui, bonjour. Mes questions sont en français pour M.
Hello. I have some questions in French for Dr.
Vous avez peint un portrait peu reluisant de la situation actuelle. Vous avez dit qu'on en aurait pour des mois. Je me demandais concrètement à quoi les Canadiens peuvent-ils s'attendre? Est-ce qu'on parle d'un isolement prolongé de plusieurs mois? Est-ce qu'on parle de période de quarantaine sur une période de 1 an, 6 mois? Qu'est-ce que vous pouvez leur dire?
Oui, on ne peut pas prévoir qu'est-ce qui va se passer à l'avenir, mais on a, comme on dit, les signes encourageants. Qu'est-ce qui se passe actuellement en Colombie-Britannique? C'est quoi les effets de nos efforts collectifs pour ralentir la propagation du virus?
Oui, tout à fait. Et mon autre question, c'est à propos de cette annonce faite par M. Trudeau aujourd'hui. Donc, on dit que les Canadiens qui sont malades ne pourront plus embarquer sur des avions ou des trains. Je me demandais, comme responsable de la santé publique, comment est-ce que les employés de ces compagnies aériennes ou sur rail doivent évaluer la situation? Est-ce qu'il faut prendre la température des gens? Qu'est-ce que vous leur dites en ce moment?
Merci pour la question. Je pense qu'il y a deux aspects. C'est fait longtemps. On a dit que c'est important pour tous les Canadiens. Si vous êtes malade, restez à la maison. Je pense que c'est aussi comme une attente que tout le monde va suivre les directions des autorités sanitaires pour rester à la maison. Je pense que pour les gens qui travaillent pour les lignes aériennes, c'est comme aussi à l'étranger. On va surveiller les personnes avant l'embarquement pour voir est-ce que quelqu'un a vraiment des signes d'être malade, mais en fait de compte, ce n'est pas une garantie de 100%. Et je pense que le message le plus important, c'est vraiment pour tout le monde. Si vous êtes malade, prenez pas de voyage, restez à la maison.
If you are sick, do not travel. Stay home.
The question was, in English? Okay, the question was for what should... I guess companies train in airplanes, etc., for domestic travel that the Prime Minister just announced. What we're saying is that the message is really, in a sense, at the core, no different. We've been saying from a public health perspective for several weeks at least that if you are sick, stay at home. So really, I think there is an obligation, I would say, a civic duty for people to understand that if you are sick, you should not be taking a commercial travel means such as an airplane, a flight, or taking a train to go anywhere in the country. You should be staying at home. Of course, the people actually are the personnel working for the airlines and the trains. They will do their best. They'll look at people who want to board and look for obvious signs that someone's ill, etc. But in terms of very systematic screening, there's no guarantee. People can always hide symptoms, take Tylenol. So I think at the end of the day, it really comes down to our collective understanding and collective, I think, motivation and approach to do the right thing. If you're sick, don't travel. Stay at home.
Thank you. Now we'll take a question in the room.
Hi, Ashley Burke, CBC News. Can you tell me about plans to run field hospitals, why they might be needed down the line, and how soon are you estimating that they would be needed in Canada?
So that's there's a significant amount of planning in the province and the territories. A good example would be from British Columbia, even yesterday, where they have very systematically planned out different scenarios and exactly how much capacity they have. Public health is going to do whatever it can to reduce the impact of this epidemic so that you don't go beyond your capacity to cope. Having said that, of course, you have to prepare for much more worst-case scenarios. So those things are absolutely happening in the provinces and territories. We've been in contact with them on a daily basis. So they are already planning alternative care sites, how to care for people who are not so sick outside of the hospitals designated for COVID-19, for example. And so the idea is they're freeing up ICU beds and also the intensive care, more serious illnesses have to be taken care of in a hospital setting, and then how to look after people who could be looked after in more alternative sites. So all of that is at play, even though right now Canada is coping. So those calculations, I would actually encourage people to just have a look at the example of British Columbia, where the numbers are actually quite well articulated.
My other question is, you talked about the optimism in BC and the modeling done there. Will the federal government be sharing their same sort of modeling publicly with us?
Yes, so absolutely. As I said, there's an epidemiologic report that's already being posted. At the federal level, we have to take into account a national picture, which I think is very important, and looking how we are trending in comparison with other countries that have gone before us, if you like, and looking at their experience and where we're tracking. So that is absolutely the intent. I also want to flag that the national aggregated picture must be supplemented by the provincial and local picture, because different areas of Canada are actually experiencing this outbreak. It's just slightly different trajectories and timelines. So unpacking what's underneath a national picture, I think, is very important. So I am, of course, very happy that British Columbia has done that. We've been supporting different provinces to do their own projections as well.
And sorry, when are you planning on releasing that publicly?
Well, some of that data is already now, since today or last night, already on our website. We'll be making as much of that available as possible. I'll have to just caution that, of course, modeling is modeling. That's just, planning scenarios. What you have to look at is the epidemiologic report in real time where things are trending.
Thank you. Next question in the room.
Hi, Ian Wood, CTV News. Today, the Prime Minister announced that there's going to be further screening on domestic travelers, air travel and train travel. Should we not be taking these steps at a local level? I mean, what good is it if we're screening someone traveling a long distance within Canada, but not someone, say, getting on a public transport bus or riding in a taxi?
So there are, I think you would actually observe that all across Canada, the provinces and the municipalities are taking this really seriously. They're already stopping gatherings. They are advising this 2-meter distance on transportation. And so that includes buses and other things, where as much as possible you're doing physical distancing. So all of those measures are already being implemented in the local jurisdictions. While maintaining as a balance, society does have to go about as much as possible maintaining essential functions while doing physical distancing. But obviously each of the municipalities, the cities, are in very different situations. Toronto isn't going to be the same as a more rural area, for example. So I think that every level of government is doing whatever it needs to maintain that physical distancing.
If I could just add to that, sort of my previous answers that certainly governments, companies, and so on can put whatever measures in place. They're never going to be foolproof. Someone can hide symptoms and so on, take a Tylenol if they do have a fever. So I think at the bottom line, it really is, I think, the collective responsibility, but for each citizen here in Canada to understand and appreciate it's important that the important role they can play. If you're sick, stay home. Don't take public transportation.
And one follow-up?
Yeah, my second question was on with regard to the United States. Obviously, it's a bit of a wildfire situation there. Cities like Detroit are hotspots, also in Washington State near the border. I know you've spoken a bit about this, but there has been concern addressed by, say, the city of Windsor across the river from Detroit. Should we be satisfied with the ban on non-essential travel, or do we need to step up our border enforcement and border closures with the United States, granted that the somewhat reckless direction they are taking?
So I've just said it's not just reducing the non-essential travel. We do have a emergency order under our Federal Quarantine Act that then are ordering travelers to isolate if they're sick, but also mandatory quarantine or essentially of anyone who is asymptomatic. So they will have to go directly home, depending on if they have a home, and if they don't have a home, the federal government will be housing people in our federal quarantine facilities. So, and as I said, the penalties are pretty heavy. Now, let's just say that even on a daily basis, we do have instances. We have truck drivers who have been stopped and been put in a federal quarantine site because they've shown even mild symptoms. So that's happening in real time right now. And then they get tested, and then if they're okay, they can continue. If they're not, they're staying at our quarantine sites.
Thank you. Operator, over to the line for 2 questions.
Thank you. Merci. The next question is from Teresa Wright from the Canadian Press. La prochaine question est de Teresa Wright de la Presse canadienne. Your line is open. Votre ligne est ouverte.
Good afternoon, Dr. Tam. Yesterday we heard that the number of patients in ICUs doubled in Ontario in less than 2 days. How concerned are you about this spike, especially considering that ICUs were the first parts of hospital systems to be overwhelmed in places like Italy and Spain?
Yes, so I think that's, as I said, we have to monitor the severity of illness very carefully because if there's increase in critically ill people, the key spike is going to occur if health systems are overwhelmed. So having enough ICU facilities is very, very important. So that has to be tracked. Right now, all jurisdictions are coping with the numbers, but they are planning to do more. Even Ontario and BC and many jurisdictions have actually emptied out probably about half of the ICUs just to make sure that they are already prepared for any influx. But of course, from a public health perspective, we just do not want people to end up in the ICU. So on the prevention side, based on what we understand, a lot of the ICU patients in a number of jurisdictions are people, say, from long-term care facilities. They are the older population and people with underlying medical conditions. And that's why we've really, really stressed that we have to protect these populations. Otherwise, we would have more ICU admissions. So I think unpacking the epidemiology underneath the people who are being critically ill does show us that they are the vulnerable and they are the elderly. And so long-term care facilities, making sure that nobody sort of introduced the virus there. And absolutely no introduction into hospitals and other places where vulnerable people go. But also on an individual level, do not go anywhere near someone who's vulnerable or older in your family even, or your friends. Do not try impact them because you will see increase in serious illness if that is the case. So maintain that bubble and definitely keep the bubble away from anyone who is vulnerable. But based on what I've seen so far, the health system is able to manage their patients.
And one follow-up?
Yes, and just on the announcement today from the Prime Minister on passengers on domestic flights and trains not being allowed to board if they're showing symptoms, can you provide any more details about exactly how that they will be screened and how that those new powers being given to airline companies and train companies will be enforced?
So I think those details will come in the coming days, and obviously working very closely with the Minister of Transport, and that is the, that I think the media and the public will get the information as that unfolds. So stay tuned.
Thank you. Operator, next question on the line.
Thank you. Merci. The The next question is from Mélanie Marquis from La Presse. La prochaine question est de Mélanie Marquis de La Presse. Your line is open. Votre ligne est ouverte.
Merci. Docteur, juste un peu pour suivre la question de ma collègue, qu'est-ce qu'on devrait faire spécifiquement ou qu'est-ce qu'on va faire spécifiquement pour les employés des compagnies aériennes ferroviaires pour contrôler les symptômes? Est-ce qu'ils vont prendre la température? Est-ce que donc c'est à eux que revient ce fardeau-là? Pouvez-vous juste concrètement nous dire ce qui va se passer à partir de lundi dans les trains et pour les compagnies aériennes?
Oui, merci pour la question. Comme Dr. Tam a dit, nous continuons à travailler étroitement avec nos collègues de Transport Canada, aussi avec les compagnies des lignes aériennes, aussi comme Via Rail, pour élaborer exactement c'est quoi les protocoles. Donc, il faut attendre un peu parce que c'est juste annoncé et des détails vont sortir bientôt.
OK, mais juste pour précision, là, puis ensuite j'aurai une question de suivi. On entend beaucoup de témoignages de lecteurs qui disent que ça ne fonctionne pas à l'aéroport, que les gens pensent que qu'il n'y a pas vraiment de filtre de contrôle. Donc là, vous venez ajouter un fardeau supplémentaire à une situation qui déjà semble problématique. Puis juste ma question de suivi aussi, Dr. Roux, qu'en est-il de la chloroquine et de l'hydroxychloroquine? Est-ce que le Canada a une position à ce sujet-là? Est-ce qu'il y a des tests cliniques qui sont donnés tout juste à
Deux questions. Concernant les protocoles à nos frontières aussi pour les compagnies, comme j'ai dit plusieurs fois que oui, on a toujours un système, c'est ce qu'on fait à nos frontières, même avec surveillance aussi pour les passagers avant embarquement pour un avion ou même pour un train maintenant, peut-être à part de lundi. C'est fait partie seulement une couche d'un système avec plusieurs couches et un système intégré parce que c'est pas seulement à nos frontières ou avec un transport en commun, on va garantir qu'on va prévenir tous les cas d'infection. C'est aussi tous les ordres du gouvernement, mais aussi, comme j'ai dit, c'est aussi tous les Canadiens, Canadiennes, parce que tout le monde a une part à jouer, un rôle à jouer. Si on est malade, on demande des gens qui sont malades de rester à la maison. Prenez pas le transport en commun. Ça, c'est la première chose. Deuxième, oui, on veut garder le personnel des compagnies de lignes aériennes. Si quelqu'un visiblement malade avec des symptômes, on va interdire de prendre le vol, mais c'est seulement un aspect. À part de ça, c'est aussi important. Si on trouve quelqu'un qui est malade, la personne va directement en auto-isolement. Peut-être je peux aussi élaborer parce que nous autres, les frontières internationales, c'est un mandat, c'est une responsabilité du gouvernement fédéral. Donc, pour tous les voyageurs qui arrivent à nos frontières internationales, peut-être sur le train avec les États-Unis ou aussi à nos aéroports, on a vraiment deux aspects. Les personnes qui sont symptomatiques malades, on va prendre soin, on va les mettre dans un hôtel ou un autre établissement sous contrôle du gouvernement fédéral où on donne des directions vraiment très claires et sévères. Vous êtes en quarantaine, il faut aller tout de suite directement à votre maison pour isolement, pour se mettre en isolement. Pour les gens, les voyageurs qui sont asymptomatiques, qui ne sont pas malades, aucun symptôme, eux aussi, ils doivent rentrer tout de suite à leur domicile et rester là parce qu'ils sont sur un ordre de quarantaine fédéral.
Because that is a federal quarantine order.
Okay, I can't remember what I said.
Thank you.
Screened at airports or just for domestic? What we've been saying is that any screening be it at our international borders, at the airports, or even now domestically at train stations or people boarding a domestic flight, is only one aspect. It's never 100% guarantee that we're going to stop further transmission of infection. Personnel at train stations, even at the airports, looking at passengers about to board domestic flights, they'll be doing what they need to do in terms of looking for people who have symptoms of obviously illness, if people look unwell, but that's never a guarantee. We know people can hide symptoms by, for example, taking a Tylenol or so to mask a fever. And so at the end of the day, I think it's not just a responsibility of governments, airline companies, train companies. It's a responsibility of every Canadian. If you are sick, stay at home. Don't take the chance of exposing others to the infection that you have. So I think that's about as clear as we can say it, and we've said it many, many times, and I think it bears repeating. So the other point I was making was that for travelers who come at our international borders, that is under federal responsibility mandate. So it's very strict since obviously March 25th when we put a new order in. All individuals, travelers who come to Canada from outside are subject to a mandatory quarantine order. And that's very straightforward. If we find you at the border, collectively the Government of Canada agents, and you are sick, we will either put you in a federal quarantine facility and look after you and make sure that you get the proper care and treatment, or if you have mild symptoms, we will arrange for transportation to get to your home for immediate isolation, to not leave your residence until obviously you're declared to be recovered. For those travelers who come at our border who do not have symptoms, who are looking and feeling well, they are also under a federal quarantine order. And they are also ordered to proceed directly to their residence and stay there. As I said before, that means very strictly that they should not be leaving their property. They should arrange for family and friends to get groceries for them. It's quite strict. To be honest, one of the things that we recognize and we're working through with provincial authorities is that at the end of the day, it's a federal order, but these people live in provinces and territories. And so obviously what happens in Nova Scotia, it may be in a rural setting, someone has a farm, it may be obviously easier to comply with the federal order and stay on your property than if, for example, you live in a condo in Montreal. We recognize it and we're working through that as well. Thank you. La prochaine question pour français pour hydroxychloroquine. Je sais, il y a des essais qui sont en train d'examiner si c'est un traitement efficace, mais à date, il n'y a aucune évidence que l'hydroxychloroquine est un traitement efficace pour le traitement de COVID-19 et c'est quelque chose, on suit aussi l'évidence et les autres expériences scientifiques à travers le monde et aussi au Canada, mais je peux aussi dire que c'est important que les gens reconnaissent que c'est un médicament important pour traiter les autres conditions. On ne veut pas avoir une pénurie de médicaments importants pour les autres conditions médicales parce que tous les gens pensent que c'est peut-être un traitement pour le COVID-19. Il n'y a aucune évidence que l'hydroxychloroquine est un traitement efficace pour le COVID-19, mais on sait déjà que c'est un traitement efficace pour beaucoup d'autres conditions médicales.
However, we do know for a fact that it is effective for treating other medical conditions. Coming back to the room.
Thank you. Once again, please press star 1 on your telephone keypad if you have a question. De nouveau, n'hésitez pas d'appuyer sur étoile 1 pour toute question. The next question is from Kira Ferguson from Sudbury.com. La prochaine question est de Kira Ferguson de Sudbury.com. Your line is open. Votre ligne est ouverte.
Thank you so much for your time. I was just wondering what, I know obviously our travel restrictions in place for travelers coming over the border in any direction, but for our cross-border workers, what restrictions are being placed on them in one direction or the other?
So those that are providing some of the essential services or that their daily work happens to be across the border, even though they have we're not asking them to stay in a certain place for the 14 days. There are strict directions to them of monitoring. They have to avoid crowds, do all the social distancing measures that we expect everyone to do, and monitor the symptoms and report them. We're also have been in touch with employers for setting up measures to monitor the employees as well. So if you are going across the border for any reason, there's a collective responsibility on behalf of the employee and the employer and the governments who are trying to ensure the safety of each other's citizens. And so it is not to say that these workers can do whatever they want. They must essentially self-isolate as much as possible. They have to do the social distancing and monitor the symptoms.
Okay, but there is, as you said, obviously no strict isolation, no 14-day isolation upon their return. They are welcome to attend a grocery store or seek other services in town if necessary?
So the direction is to avoid crowds and avoid contact with the public as much as possible. Say, if you were a pilot that's just come in, and of course you have to fly back out again in order to do your job. But what public health is telling them is go straight to your hotel, do not leave the hotel, get your food ordered, and go back on the plane, basically.
Perfect. Thank you so much. If I may, a follow-up question?
Sure.
Are there any additional cleaning measures in place for the products crossing the border, as there are concerns that the virus could remain on the products themselves? I apologize. Products or goods or services being shipped, not services, but goods being shipped across the border to the U.S. or those being received into Canada. Are there any additional cleaning measures to these products before they're distributed to the public?
We'll follow on that because obviously is to do with other departments, but we work very close with them and we can get the answer to your question as a follow-up.
Thank you.
Thank you. We'll take a question now from the room.
Hi. Yesterday, the health minister talked about how they were trying to procure ventilators at a federal level for all the provinces and territories, but mentioned that there were a couple provinces and territories in particular that were trying to order these themselves, so that they weren't getting them through the federal government. Do you know what provinces those are, and what's the problem with that?
Well, I think obviously different provinces can procure different products. At a time when there's a general scarcity in supply, we absolutely encourage jurisdiction to come together and be part of our collective purchasing. So that doesn't necessarily preclude jurisdictions, but there's many advantages in being part of the bulk purchasing because everyone is looking for the products, and if we pull our requirements together, we will stand a better chance to get access to some of these as well. So the federal government can help with if the product comes from another country. One can help facilitate some of those access and transportation and distribution, for example. So it's a collective measure, but we cannot essentially dictate what individual jurisdictions might do. But collectively, we stand a much better chance to get access to scarce resources. But on top of that, the federal government has added an extra layer of protection, which is even if no orders have been placed for the provinces and territories, we're actually purchasing them preemptively should they be required.
So sorry, what provinces are going out on their own and getting their own ventilators rather than federally?
I don't have that specific information, but we certainly encourage everybody to be part of that purchase order.
And the data you just mentioned that was uploaded on your website last night, can you tell us what your big takeaway from that is that Canadians should know when you look at that new data, what kind of a picture it paints?
Well, I think certainly this is a serious illness. And so the picture it will paint is that there are definitely serious consequences of hospitalizations, ICU, care requirements, as well as, of course, the mortality or the deaths. So, but I think it would also tell us that even though some of the severe impacts are the older population, it doesn't mean that the younger population isn't impacted. There's the bulk of the illnesses are actually in the younger age groups. It's just that, and some severe illnesses do occur, but while the heaviest impacts are on the older age groups. I think also it is there to set a sort of national trend to see where things are trending. And as I've just said, well, BC, of course, is an area that was first impacted, but it will show you the curves for each of the jurisdictions and where the cases are. So if you clicked on the map, yes, it'll show you the number by province, but it'll show you the sort of numbers over time for each of those jurisdictions as well. So trending, so national surveillance is important for trends. And there'll be some sort of, as I said, sort of age group breakdowns as well. I just want to emphasize that, of course, if the trends are slowing down a bit, our key message, though, is not to sort of relax. Our key message actually is to double down, absolutely double down. And that right now is an absolutely critical time. And if you looked at those numbers, you realize that we're definitely not out of the woods and we got to keep going. Donc, lâche pas la patate.
We must keep it up.
Thank you. Next question in the room. This will be the last one.
There's some reports in the United States that the CDC is going to recommend this week that all Americans going out in public are going to wear masks. And while we've talked about masks before not being wholly effective for members of the public, if the CDC were to go ahead with this, is that something that perhaps will be headed to in Canada? And can you just speak about whether that's something we should be considering?
Well, we'll always evaluate new data as it comes along. Our position right now is that put a mask on someone with symptoms if they should need essential services. Like if you have symptoms, you have to stay at home. You should not be wandering around the community. If you need to get to a medical facility, at that point in time, that mask might actually be useful because you now have infectious droplets that you might send to others. But the key is to keep that 2 meter distance. Masks have to be utilized appropriately too. Most people haven't learned how to use masks. So there's many practical aspects of this. So our advice right now is there is no need to use a mask for well people.
Okay, merci. La séance est maintenant terminée. Thank you.
Thank you. The conference is now ended.